Hi, I'm Jim Polciani. I'm the director here at the Institute for Anatomical Research. We are going to talk about lab safety today. It's one of the most important things that we do here in the lab, besides learning, which is be safe and take care of ourselves. When we begin a dissection session, what we'll find is that we'll have a tray of tools set up for you. So I'm going to wander over to the sharps area and pick myself up a tray. So the tray that we'll have a hemostat in it, we'll have a scalpel in it, and this will be your tools that you'll be responsible for the day and that you'll be using throughout your whole dissection process. I'm going to take that tool carefully over to my dissection area, place it down next to me where I'm ready to go, and I'm going to establish my field of work. Now, we'll probably be working with maybe one or two or a few other people around the table, and we want to make sure that we communicate with our colleagues so that everybody has their space and we all know where we're working. And that way we can kind of establish sort of a zone of work, a sort of a zone of safety around us to make sure that we're careful and we don't bump into and or injure our colleagues. Now, when we're ready to start our dissection process, we're going to, engage with our tools. Let's look at those tools a little bit closely and see how we work with them. So the first tool that we'll take a look at is the hemostat. Now the tendency for the hemostat is to want to grab it like a pair of scissors. We don't use it like scissors. What we actually do, take the fingers, hold them out like an L, and we take the hemostat and hold it like we're putting it in our palm, except we slide the rings around our index finger and thumb, and then we use the last three fingers as kind of a counterbalance or kind of a fine tooth or fine tuning of the grip there. That is the handle there. Now, one of the things I'll bring up for you about holding the hemostat in this way is we want to be careful in the thumb area about how tight we hold that. Keep a soft hand. The tendency sometimes is to press the thumb real tight up against that ring, and you'll compress the nerves in the thumb, which can cause some numbness and or pain around the thumb region. If that starts to happen, ask one of us and we'll get you a Band-Aid to cover that. Now, let's take a look at the scalpel and see how we handle that. Now, I want to be careful when I grab the scalpel, and I want to grab it way in the back to pick it up. And then when I handle the scalpel, I'd like to point out to you that there are some bumps here. We kind of call them speed bumps. And the fingers should not really go past them. As soon as you start to feel your fingers get into the speed bump zone, you're getting close to the blade. Now, if you look at the blade a little bit closely, you'll see that one side is kind of a rounded side, and then one side is a straight up side. This is the dull side. This is the sharp cutting side. Most of the engagement with the tissue is going to actually be done at the tip and not the bladed side here, although there are some techniques where we do use that. Now, I want to point out to you the position of the scalpel in my hand. It's not held like this most of the time, although there are times where we'll change grips and we'll use different grips for the scalpel in our hand. But again, I just want to say that wherever we hold that scalpel, our fingers stay well behind the speed bump. Now, I'm going to keep the scalpel in my hand. I will engage my hemostat and hold them in my hand with them in my palm, with my fingers doing the fine tune, and then I'll bring them to my field of zone to work with the body tissue. As I engage the tissue with the hemostat, I can take my scalpel in and do the work. Now, always only engage the tissue with the hemostat and use the scalpel to do the work. We want metal on metal. These things are meant to cut flesh. We do not use our fingers to engage the tissue. Only the hemostat. Now, if I've done some work and I'm done doing the work, or I would like to pause and chat with my fellow classmates, what I need to do is take my tools, carefully place them back into my tray, and then I can step back a little bit and I can engage my colleagues with no tools in my hands. I can do whatever things I need to do that I don't want to do with the tools out of my hands. If I need to step away, let's say for a short minute, for a bathroom break or something like that, I want to make sure that my tray is placed in a position so that it is away from the cadaver and in an obvious place if they end up doing some moving that it won't get covered up in there. I can step away from the table for a moment or two and then come back to my field of work, establish my position, and then get ready to do my dissection. Now, if I am going to step away from the table for a length of time, like let's say I'm going to take a break for more than a minute or two, I want to take that tray and take it off of the field of work so that they can work around, they can move the cadaver and do whatever. And what I'll do is I'll take that tray carefully around to the sharps area, and I can place it into the sharps area where it's safe, and then I can step away and do whatever I need to do. When I come back, I'll grab my same kit, and I will take it back to my field of work. Again, establishing with my colleagues where we're at, and then begin the dissection again. Now, let's say that at some point I'm working along and my scalpel feels dull and I want to replace the scalpel. I can take my tools, place them back into my tray, leave my hemostat and my tray on the table, and then I'm going to grab the scalpel. Now, when I walk with a scalpel without a tray, I want to hold that scalpel tight to my body. Now, here's where I'd like to mention to you that here in the lab, we want to make sure that you are using full-length pant legs and closed-toed shoes, because if you drop the scalpel, you have some kind of protection over that. So as you see, I'm holding that scalpel tight to my body. That way, as I'm walking, if anybody is close to me or bumps into me, they're less likely to get poked or get injured as I'm carrying that. If I accidentally drop the scalpel, do not try to catch the scalpel on the way down. Step away from it, let it fall completely to the floor. It will not injure our floor, we can fix that. And then you will carefully look around you, make sure that nobody is close by. You're gonna lean down, grab your scalpel, keep aware of your environment, keep that scalpel close to your body, and then bring it over to the sharps container. When you get to the sharps container, what you'll notice is there are two bins. There's a dirty bin and a sharp bin. In the dirty bin, there is a little drawing in there that shows what appears to be a blade pointing this way. And what that is to tell you is that when we place the scalpel in the bin, we want to make sure that all the blades are at one end of the tray and that they're not set in there, helter-skelter with the blades in different directions. That's just a safety thing for those of us that are managing it. You don't need to manage the scalpel from that point on. You're going to place your dirty scalpel in the bin, walk up to the sharp bin, make sure that you're carefully grabbing a new scalpel out of that bin, and then you're going to, again, engage that scalpel close to your side, be aware of your environment and your people around you, take it back to your field of work, reestablish your position, your colleagues around you. We all know where we're at and where we're working, and then I can grab my tools and get back to work. When I'm done, place them down. That way I don't talk with my hands. As an Italian, I tend to use them a lot. So, and finish whatever discussion that I need to discuss. That is the procedure of handling a scalpel here in the lab, and probably one of the most safest ways that we've come up with for taking care of this educational experience. Thanks for spending some time with me, and have a great day.